Hello and welcome to Pharma Z's pharmacy teaching videos. These series of videos are focused on minor ailments, so common conditions treated with over-the-counter medications and a device, and today's topic is insomnia. Insomnia is a common condition which is reported by most people at some point in their lives, and it's thought to affect about 1/3 of the general population in the UK. It's defined as difficulty in initiating or maintaining sleep despite having adequate time and opportunity to do so, which causes poor sleep quality and impaired daytime functioning. Sleep disturbance without impaired daytime functioning is not considered to be insomnia. The most common symptoms of insomnia are difficulty falling asleep, waking up during the night, or waking up early in the morning, as expected. Daytime symptoms typically include cognitive difficulties such as poor concentration and impaired memory, mood disturbances, in particular anxiety, depression and irritability, and fatigue. If insomnia affects how alert a patient is the next day and so puts them in danger from motor accidents or falls, for example, they should be referred to their GP for a routine appointment. The prevalence of insomnia is 1.5 to 2 times higher in females than males and can occur at any age, but is most common in older adults as prevalence increases with age. Factors such as daytime napping and stress increase the likelihood of sleep problems. According to NICE guidelines, short-term insomnia is classified as insomnia symptoms occurring for less than 3 months duration, typically a few days or weeks, and may be caused by stressful events such as bereavement, illness, changes in employment, exams, pending deadlines or financial difficulties, or due to changes in sleeping patterns, potentially due to having a new baby or night shifts, or environmental factors such as excess noise, light, extremes of temperature, or jet lag. Short-term insomnia is very common and usually resolves once the causative trigger has been resolved. Chronic insomnia is insomnia symptoms occurring on at least 3 nights per week for 3 months or more and should be referred to the GP. Chronic insomnia commonly coexists or is caused by other conditions including psychiatric disorders such as anxiety and depression, medical disorders such as COPD, heart failure, neurodegenerative diseases, malignancy, musculoskeletal conditions and chronic pain, or substance misuse such as alcohol and illicit drug use. In cases of chronic insomnia with one of these causes or a suspicion of an underlying health condition being the cause, patients should be referred to their GP for a routine appointment. There's also something called rebound insomnia, which may occur during withdrawal from hypnotics or antidepressants. In cases like this, you should advise your patient to undertake withdrawal slowly and gradually, or as advised by their prescriber. A sleep diary can help assess sleep difficulties and daytime impairment over time. It should be kept for 2 weeks and record the time of going to bed and getting up, the time taken to get to sleep and the number and duration of episodes of waking during the night, episodes of daytime tiredness and naps, times of meals, alcohol consumption, caffeine consumption, and significant events during the day such as exercise or stress, and rating of sleep quality. So ask the person to rate the quality of their sleep each night from 1 to 5, where 1 is very poor and 5 is very good. There's also a short test on the NHS website from Sleepio which gives a sleep score plus practical tips and advice for improving sleep. So what is normal sleep? Sleep is an important factor in many processes including neural development, learning, memory, regulation of emotion, and cardiovascular and metabolic functioning. There is no standard definition of normal sleep. Everyone needs different amounts of sleep. However, on average, the optimal sleep duration in adults is 7 to 9 hours, in children it's 9 to 13 hours, and in babies and toddlers it's 12 to 17 hours. With aging, the number of times a person wakes up during the night increases and the total sleep time decreases. The normal time taken to fall asleep, which is called the sleep onset latency, is usually considered to be less than 30 minutes. So what are the over-the-counter treatments for insomnia? Antihistamines such as promethazine, which is in Sominex, and diphenhydramine, which is in Nitol, are licensed for the over-the-counter management of temporary sleep disturbances. There is little evidence to support their use, but they are still widely used. They can be taken by most adults and young people aged 16 years and over, so would refer patients to a GP if they're under 16 years and experiencing insomnia symptoms. Antihistamines don't cure insomnia. They simply cause drowsiness, so it's an exploitation of a side effect to temporarily aid sleep problems. However, they should not be used for longer than 1 week for promethazine and 2 weeks for diphenhydramine, at which point a GP referral would be appropriate if insomnia symptoms persist, as it could be an indication of an underlying medical issue. Promethazine is taken up to 1 hour before bed, whereas diphenhydramine is usually taken 20 minutes before bed, and it normally takes about 30 minutes to work. These treatments are not suitable for patients with lung problems such as asthma or COPD, have an eye problem such as glaucoma, have stomach ulcers or a blockage in the stomach or gut, have kidney or liver problems, have problems passing urine or emptying the bladder, including prostatic hypertrophy and urinary retention, or have epilepsy or any other health problem that causes fits, as they can affect the seizure threshold. They should also be used with caution in the elderly, who are more likely to experience adverse effects. In particular, avoid use in elderly patients with confusion, as it can really exacerbate that symptom. In terms of side effects, antihistamines can cause residual drowsiness the next day. Drowsiness usually wears off 8 hours after a dose, but you should advise your patient not to drive or use tools or machinery if they're feeling this way. Tolerance may also develop with treatment, so patients may feel less of a sedative effect after a few days of continued use. Other common side effects include feeling sleepy, dizzy, or unsteady on their feet. If these antihistamines make them feel this way, then advise your patient to stop what they're doing and sit down or lie down until they feel better. They can also cause difficulty in concentrating and dry mouth due to the anticholinergic effects. If dry mouth is an issue, you can advise your patient to chew sugar-free gum or suck sugar-free sweets. Patients over 65 years are more susceptible to these side effects, as we've discussed. In terms of interactions, these treatments may potentiate the sedative effects of alcohol and other CNS depressants, such as hypnotics and anxiolytics. As they have antimuscarinic activity, the effects of some anticholinergic drugs, such as tricyclic antidepressants, may also be potentiated, causing exacerbated symptoms of drowsiness, dry mouth, and urinary retention. Of course, they should also be avoided if a patient is already using a product containing antihistamines, such as those in cough and cold remedies. Alternative or complementary herbal remedies such as valerian, lavender, or melatonin may also be used, but there is insufficient evidence to make a recommendation regarding the efficacy of any herbal remedy in the management of insomnia. There is some evidence for valerian having a small benefit, but hepatotoxicity has been reported with its use, so make sure you check with your patient for existing comorbidities if a patient requests this. Also, there may be issues regarding interactions between herbal products and pharmacological medicines, so bear that in mind, as well as the alcohol content in herbal remedies. And finally, sleep hygiene advice, which is really important advice to give to a patient. Sleep hygiene aims to increase awareness of behavioural, environmental, and temporal effects that may be detrimental or beneficial to sleep. So I've created a table of do's and don'ts to advise your patient. Do develop a bedtime routine and sleep schedule, in particular going to bed and waking up at the same time every day. Do relax at least 1 hour before bed. For example, take a bath with the addition of lavender essential oils, or read a book, or drink a warm milky drink before bedtime. Do make sure your bedroom is dark and quiet. Use curtains, blinds, an eye mask, or earplugs if necessary. Do have a comfortable sleeping environment, which isn't too hot, cold, noisy, or bright, and make sure your mattress, pillows, and covers are all comfortable. And on waking up in the morning, increase exposure to bright light so that your body gets used to it. In terms of don'ts, Do not smoke or drink alcohol, tea or coffee at least 6 hours before going to bed. Caffeine preferably should be avoided after midday, and alcohol in particular can contribute to poor sleep maintenance and should not be used as a sedative, as rebound excitation can cause early morning waking and its diuretic effects can also disturb sleep. Do not eat a big meal late at night within 2 hours of bedtime. Do not exercise at least 4 hours before bed, but exercise is beneficial earlier in the day and can aid with sleep. Do not watch television or use devices like smartphones right before going to bed, because the bright light and blue light in particular on electronic devices can suppress melatonin production. So avoid using devices for 2 hours before bed. Avoid watching or checking the clock throughout the night, and do not nap during the day or have a sleep-in after a bad night's sleep. It's better to stick to a regular sleeping schedule instead. And finally, and definitely, do not drive when you're feeling sleepy. So that's all for our insomnia video. I hope you found this useful, in particular the diagnosis, treatments, and sleep hygiene advice, which should never be left out because it can really make a difference. As always, please like, subscribe, and share our YouTube channel, as well as following us on Facebook and Instagram, where we post quizzes related to the topics. Thank you.